Hello everyone, welcome back to our channel. In today's video, we're going to talk about one of the most contagious and dangerous diseases out there, measles. Measles is a highly infectious viral disease that can spread quickly through communities and cause serious health problems, including death. In this video, we'll be discussing what measles is, how it spreads, and how it can be prevented. History of measles. Measles is an ancient disease that has affected humans for thousands of years. The first recorded description of the disease was by a Persian physician, Rhazes, in the 9th century. The virus responsible for measles was not discovered until the 1950s. Before the introduction of measles vaccines in the 1960s, measles was a common childhood illness worldwide, causing significant illness and death, particularly in developing countries. In the United States, before the vaccine was available, an estimated 3 to 4 million people got measles each year, with 400 to 500 deaths and 48,000 hospitalizations annually. About measles virus. Measles virus is a member of the paramyxovirus family. The virus is a spherical or pleomorphic enveloped particle that is approximately 150 to 250 nanometers in diameter. The measles virus has a single-stranded RNA genome that encodes 6 structural proteins, including the nucleocapsid protein, the phosphoprotein, the matrix protein, the fusion protein, the hemagglutinin protein, and the large polymerase protein. The hemagglutinin and fusion proteins are located on the surface of the virus particle and are responsible for viral attachment and fusion with host cells. How measles transmits. Measles is primarily transmitted through respiratory droplets. When an infected person coughs or sneezes, they release droplets into the air that contain the virus. These droplets can be inhaled by other people nearby, leading to infection. The virus can also survive on surfaces for several hours, so it's possible to contract the disease by touching a contaminated surface and then touching your mouth, nose, or eyes. Pathogenicity of measles virus. The pathogenicity of the measles virus refers to the ability of the virus to cause disease in humans. The virus enters the body through the respiratory tract and can spread rapidly throughout the body, leading to the characteristic symptoms of measles. The virus can also cause damage to the respiratory epithelium, leading to respiratory symptoms. The measles virus primarily infects immune cells, such as macrophages and dendritic cells, which can result in immunosuppression and a weakened immune system. This can increase the risk of secondary bacterial infections, which can lead to more severe complications such as pneumonia, encephalitis, and even death. Symptoms of measles. The symptoms of measles typically appear 10 to 14 days after infection and can last for several days to a few weeks. The first symptoms of measles are similar to those of a cold or flu, including fever, cough, runny nose, and red, watery eyes. One of the hallmark symptoms of measles is a distinctive rash that begins on the face and spreads to the rest of the body. The rash usually appears 2 to 4 days after the onset of fever and consists of flat, red spots that can become raised and may be itchy. Other common symptoms of measles include fatigue, muscle aches, and sore throat. In some cases, people with measles may experience more severe symptoms, such as pneumonia, encephalitis, or even death. How to diagnose measles infection. Measles can be diagnosed through a combination of clinical examination and laboratory testing. Clinical examination. A doctor may suspect measles based on the characteristic symptoms of the disease, such as fever, cough, runny nose, red eyes, and a rash. The presence of these symptoms, along with a history of recent travel or exposure to someone with measles, can help a doctor make a preliminary diagnosis. Laboratory testing. To confirm a diagnosis of measles, a blood test can be done to check for the presence of measles-specific antibodies. A sample of respiratory secretions, such as a throat swab or nasal swab, can also be taken to test for the presence of the virus. How to prevent measles. The most effective way to prevent measles is through vaccination. The measles vaccine is safe and highly effective, and it's recommended for all children and adults who have not yet received it. The vaccine is typically administered in 2 doses, with the first dose given at 12 to 15 months of age and the second dose given at 4 to 6 years of age. If you're planning to travel internationally, it's essential to check the vaccination requirements for the countries you'll be visiting. Some countries may require proof of vaccination before entry, and getting vaccinated before your trip can help protect you and prevent the spread of the disease. In addition to vaccination, it's important to practice good hygiene to prevent the spread of measles. This includes washing your hands frequently with soap and water, covering your mouth and nose when you cough or sneeze, and avoiding close contact with people who are sick. If you suspect that you or someone you know may have been exposed to measles, it's crucial to seek medical attention and take precautions to prevent the spread of the disease. This may include isolating the infected person, wearing protective gear, and avoiding contact with others until the risk of transmission has passed. Treatment of measles. Unfortunately, there is no specific treatment for measles, and the virus must run its course. For measles patients, it's important to rest and drink plenty of fluids to help the body fight off the infection. In some cases, complications from measles can occur, such as pneumonia or encephalitis. If these occur, hospitalization may be required for treatment and supportive care. For those who are at high risk for complications from measles, such as infants, pregnant women, and people with weakened immune systems, antiviral medications may be prescribed to help reduce the severity and duration of the infection. Conclusion. Measles is a dangerous and highly contagious disease, but it's preventable. By practicing good hygiene and getting vaccinated, you can help prevent the spread of measles in your community. If you or someone you know has been infected with measles, seek medical attention immediately to prevent complications. Thank you for watching, and don't forget to like and subscribe for more informative videos.